Hi everyone, Adam here with another video, this time about hamstring injuries. Hamstring injuries are quite a common injury, in particular within the sporting world. The hamstring muscles are on the back of the thigh, and what they do is that when they contract, they work to bend the knee, and they also work to what's called extend the hips, so push the hips forwards. The hamstrings are often injured with sudden jerky movements to them, often things like sprinting or suddenly running. They're really key ones or common mechanisms of injury because they suddenly put the hamstrings under a lot of stress and they overstretch them as well. Most hamstring injuries are caused by when the hamstrings are stretched further than their capabilities and done at a very high velocity or very quickly. The hamstring is a collective term for three different muscles that sit on the back of the thigh. They're called the semimembranosus, the semitendinosus, and your bicep femoris, which are very complicated names, but they're essentially just the individual muscles and what they're called, and the three of them all together are called the hamstrings. Now, when you injure the hamstring, you can injure any one of these three muscles, and there's different variations or grades given to the damage done to these muscles. When any muscle is injured or damaged, essentially what it's referring to is there's a tear in the muscles, and that's graded from 1 to 3. There's 3 different grades of muscle tears. The first one being a very, very minor tear, second being a partial tear, and then 3 being a complete rupture of the muscle. The grade of the tear can be determined through imaging, so you can pick it up on an MRI or an ultrasound scan, but it can also be determined usually through the symptoms or the presentation soon after the injury. So with a grade 1 tear, which is a very, very minor tear to the muscles, you would have immediate pain, a sudden onset of pain, probably be quite tender to touch or feel around that area, but you'd still have full strength and use of the leg. There wouldn't be any loss of power or loss of strength there. A grade 2 tear, which is slightly larger, which is a partial tear of one or more of the muscles there, would be more painful when compared to a grade 1 tear, and also more tender. You might have some bruising and some swelling around there as well, which is usually quite common. You would also have some reduction in muscle strength because the muscle fibers are no longer connected, or some of the muscle fibers are no longer connected, so they can't contract to complete either bending the knee or lifting the hips forwards. And a grade 3 tear, which is a complete rupture of the muscle, would be incredibly painful, very severe levels of pain, and would be really sore to touch and really tender. You'd usually get a sort of popping type sensation as well, or feel something go, often people say, when they have the injury. And you'd also see a significant reduction in the amount of strength that you have in the leg, and you can't use the leg really because the muscle fibers aren't attached anymore, so they can't contract. You would also have significant bruising and a lot of swelling as well. So if you sustain a hamstring injury, the first thing that you should do within the first sort of 2 to 3 days is rest it as much as you can. When I say rest, it doesn't mean completely don't move at all. It means don't do anything that's likely to cause further injury to the area. So just gentle walking at most. The next thing you should do is also consider icing the area. That sort of reduces swelling and can help with pain as well, sometimes soothe the area as well. You should also compress the area if you can, so sometimes you can get compression sort of running tights, for example, or leggings. They can be quite handy in the early stages of an injury. Again, helps with the swelling side of things. And you should also elevate it. Again, that helps with swelling and draining away any sort of bruising as well, and any blood that's pooling in the area. For the first 2 to 3 days, as well as those things you should do, there are some things that you should avoid as well. The first thing that you should avoid is heat. Heat, you'll find, is particularly uncomfortable and should be avoided really. You should look at icing as a way of soothing things in the first 2 to 3 days. You should also avoid drinking any alcohol for the first 2 to 3 days after you have an injury like that, because it can cause more bruising and increase the blood supply to the area. You should also avoid any sort of activities that are going to cause any further injury to the area. So if it's a hamstring injury, you should avoid things like running is a really key one, at least for those first 2 to 3 days, even if it's a grade 1 tear, because it could make it tear it further and make it worse. And the last thing you should avoid within the first 2 to 3 days is massaging the area, mainly because you'll find it really tender and uncomfortable, and you won't really gain much from it. So for the first 2 to 3 days, don't massage it, just leave it, just ice it, compress it, elevate it, and rest it as best you can. And then after 2 to 3 days, when the tenderness comes down a bit, you might find that massage is a bit more comfortable, but again, just keep it very gentle. Once the initial pain starts to come down after those first 2 to 3 days, you should start considering doing some gentle exercises and gentle mobility and stretching exercises. Shouldn't really go doing anything significant, any long runs or quick running in particular. It's usually those explosive type actions that make it worse, especially if done too early. So how long do hamstring injuries take to get better? And that depends on the individual for a start, but then also it depends largely on how bad the tear is. If it's a grade 1 tear and it's just a very minor tear to the area, then it could be better within a couple of weeks. It might just be a bit sore for a couple of days. If you rest it, ice it, elevate it, compress it, and then start introducing some hamstring exercises slowly, and then you could be back within a couple of weeks. If it's a grade 2 injury, that's quite a broad spectrum of how significant the tear is and can take a little bit longer. So some people can be better within 6 weeks, some people it's going to take close to 3 to 6 months. It really depends on that tear, and also it depends what you're going back to. Somebody who wants to go back to swimming, for example, would probably be back to swimming a lot sooner than someone that wants to go back to something like track sprinting or playing rugby, because it's a lot more of a demand, an explosive demand on the hamstring in particular. With grade 3 injuries, it depends on whether you have surgery or not. Surgery is not essential. If the two parts of the muscle that have torn are relatively close together, sometimes it can be managed without surgery. They fix you in a splint or a brace that brings the two parts of the muscles closer together, and then give them a bit of time to fuse and knit back together. If you do end up having surgery, then it'd be following a post-op protocol and go through some rehab exercises very similar to if you didn't opt for surgery or didn't have any surgery. The healing times you're looking at usually around 3 to 6 months, optimistically. Getting back to pain-free exercise, usually you're looking further towards 12 to 18 months if it's a grade 3 rupture, because it takes that bit longer to get those muscles that muscle to fuse back together or knit back together, and then getting it strong enough to get back to what you want to be doing with it. I hope you found this video on hamstring injuries useful. If you did, please leave a like and subscribe. And if there's anything you want me to cover in the future, please leave a comment below. I'll also leave a link to my Instagram page where I've covered some exercises around hamstring injuries, and so that you can follow to get some ideas on what to do. If you do have any more specific questions, feel free to contact me or leave a comment below and I'll get back to you. Thanks everyone.